You're still very much on the station where you hear the law, you talk the law, you know you're right like never before. And this morning we're going to be talking about tuberculosis, and would look at confronting the stigma of tuberculosis and other medical challenges relating to this as well. Again, hey, don't look at me like that. Don't worry. I know it's not Tuesday. You're used to these conversations on Tuesdays, but yeah, it's important that we have this conversation today because thankfully I have call out a dear friend in the studio this morning who has been advocating this for a long time, and she said, okay, we can do this today, we can have this conversation today. I'm in Lagos, so why not? Let's stop by, let's have this fundamental conversation. She's the executive director, Dabridge Health Development Center, Deborah. Okay, Deborah, very good morning to you. How are you doing today?
Good morning. I'm fine and well.
Yeah, Deborah is not usually that soft-spoken, yeah, but yeah, she's soft-spoken. I'm just teasing. Good to have you on the program this morning. Well, let's get straight to the conversation. You've been on this advocacy to see an end to tuberculosis in Nigeria for a while now, and you've been pushing, and so we say well done to you. By the way, what data shows as regards tuberculosis in Nigeria is depressing. It's really sobering, and that is why this conversation is vital and very important. For example, data shows that Nigeria has the highest tuberculosis burden in the continent.
Yes.
Right. Yes. And that the disease kills about 260 people in the country every single day. Right. I mean, it could be more now, I suppose, but this is according to data recently published, and in further states that it is underreported. It is not something that even the media, and we're guilty. Yeah, that's fine. Maybe not fine, but we don't. It is not well reported cases. From hospitals and medical centers, not well reported. It's really underreported, and that's why this conversation is quite vital. Deborah, first, let's not assume everyone knows what tuberculosis is. So what's this disease we're talking about?
Okay, tuberculosis is a public health challenge here in Nigeria and in so many countries of the world. It is an airborne disease that is caused by a bacteria called Mycobacterium tuberculosis. But in order to just break it down, I will just go straight into what are the signs and symptoms. How do you know that you might have tuberculosis? In very clear and simple terms, if you're coughing for 2 weeks or more, go and check it.
Consistently coughing?
Yes. Coughing for 2 weeks or more, weight loss, night sweats, drenching night sweats, right? A loss of appetite. If you're somebody, the amount of food that you can consume before now, but now you see that you're losing appetite, you're losing weight, you're coughing out blood, But for some people, it doesn't really show all of these symptoms.
Okay.
But as health professionals working in the space, if you're coughing for 2 weeks or more, please visit any healthcare center and go and get checked. It might be tuberculosis. It is not every cough that is COVID-19. It is not every cough that is cough syrup. That cough that you have that has prolonged and you're thinking is an attack from your village or wherever because you've taken different cough syrups and it's not going. It might be tuberculosis. Testing and treatment for TB is free of charge in Nigeria as provided by the federal government and also by Lagos State government. It is free. You don't have to pay a dime.
Wow. Well, we'll get to that part, because if it's free, why don't people really go for this treatment? Why don't people make themselves available for this? Maybe lack of information, maybe that is responsible for that. But you just mentioned symptoms. Again, I'll come back to that part about the fact that this is free, testing is free, like you've said. We'll come back to that in just a moment. But you mentioned those symptoms, those signs, to look out for. Maybe the next question would be about prevention. Yeah. If this are the signs, how can I prevent coming down, with this disease?
Yeah, prevention is key, and that is what the whole world is pushing for. As we speak, the United Nations SDG goals have been set to end tuberculosis by 2030. Nigeria is a signatory to the United Nations political declaration, which was signed in 2018 and also signed again in 2023 at the UN by different member states, that we will end tuberculosis by 2030.
Some 6
but
years away from now?
Yes, but as we speak, we are still far from achieving that target because we've not been able to break the chain of transmission. We've not been able to really put things in place to prevent the spread. But as citizens of this country, we all have a role to play, to prevent this disease, because one person with TB can spread it to 5 to 15 others within the course of 1 year. People are dying. I know you spoke about the statistics earlier, but it will shock you to know that WHO data that was released in 2023 says that we lost 88,000 Nigerians to tuberculosis in Nigeria alone.
In the year 2023.
According to the 2023 report, it quotes data of 2022. So in 2022, we lost 88,000 Nigerians, 88,000 people in Nigeria, from this disease. How can we prevent the spread of this disease? Good ventilation is key. If you're in a crowded place, try to cover your nose, like when you're coughing, you don't cough into your arms.
Yeah.
You cough into your elbow. Very important, because this disease is airborne. Also, for people who are always in crowded places like markets and all that, when somebody is coughing or sneezing like that close to you, you don't go and somebody and you're like, bless you. No, don't open your mouth immediately. You should sort of social distance, I would say, not in a stigmatizing way, but the minute somebody is like coughing or like sneezing like that, and then you're opening your mouth to say bless you and stuff like that, you're putting yourself at risk. So if you want to prevent yourself from the disease, good ventilation, avoid crowded places, eat well. Good nutrition is key, to also making your immune system really strong and all of that. So I can't touch up on everything, but I think those are basic. You don't cough indiscriminately. You don't spit. When you cough, you have the phlegm. People just cough and spit.
I think the one popular one is mucus.
Mucus. You just spit no. You have to make sure that at least you cough into a handkerchief, stuff like that. It's also another way of taking responsibility as a person, but also you that is out there that you don't have it, you have to protect yourself.
Deborah, well, I'll come back to you in just a moment, right? Because you mentioned a few vital points, and I think it is time to talk about that. You mentioned the fact that when someone is around another person who's coughing, just maintain social distance in a manner that you're not trying to stigmatize. And we have a survivor, a tuberculosis survivor in the studio, Ogunto Taiwo. Well, we understand that one of the major challenges facing around tuberculosis is the fact that those who have survived this, they usually often stigmatized, and that's why hearing from Taiwo this morning is very important. Taiwo, you want to state your experience with tuberculosis, how you survived this, and where the space you're in right now.
Good morning, all. Well, I would say I am a survivor, and a big thank you to the Lagos State government, to the Lagos State health sector, the stakeholders who made it possible for me to be here today, because without them, I might not have survived. When I had TB, it was a kind of death sentence to so many people because we lacked the knowledge. So I had to visit a private-owned sector to go and get tested. So when it came out as TB, the private-owned sector had me to come for the treatment, which the person, though the person is a professional doctor, asked me to pay a sum of money to commence the treatment, which I had to look for some other means through the government-owned sector. That's the health facilities, which the treatment was free, the test was free, and all the drugs were also free. So when the doctor got to know that I got the treatment for free, the doctor started telling people I had TB, started disclosing what my health status to the communities, to my church friends, and this deprived me of so many things. I was all alone throughout the treatment phase. There was no friends, nobody to come check up on me as someone who is on the sick bed. So I was left with my parents, and thank God to my parents and one impact Nigeria through DHDC that brought an app. The app is called One Impact Nigeria. It is like a group of survivors that are on that platform to provide help for those who are passing through this stage. And it might not be possible for those who are also passing through what I faced, because not everyone would have a strong mind like I did. So some might have given up on the treatment, or might stop taking the drugs due to the stigma.
So now that you're done with the treatment, right? You survived tuberculosis. What's your state of mind right now? You've returned home? Yes, returned home.
Yes, I was.
Those who knew that this is what you went through, are they still looking at you a certain way?
No. So the joy of tuberculosis is when you use the treatment as being told, you will be tested negative, and you cannot spread the diseases to anybody again. But for the fact that you miss the drugs, means if you are a defaulter, means you are doing yourself of more harm than benefits.
All right. Okay. Because we've got to go, Deborah, very quickly, let's talk about this testing. What do you have to say to Lagosians, to Nigerians, this testing, this free test that you say is available to, because again, not lots of persons know that this is really available. Let's hear your take on that, and indeed on treatment in general. Okay.
Let me also use this opportunity to really appreciate the federal government of Nigeria, and also the Lagos State government through the Lagos State Ministry of Health and the Lagos State Tuberculosis and Leprosy Ulcer Control Program. Indeed, what Taiwo said is true. Testing and treatment is free. You don't have to pay a dime. And currently, with support from Stop TB Partnership Geneva, there is like he mentioned, the One Impact Nigeria. It is free also of charge on App Store, on Play Store. It's important in combating the stigma we are talking about, because stigma is a major barrier to ending this disease. If we must end TB by 2030, everybody needs to come together for us to reduce the stigma. A person who is already on treatment, he cannot spread the disease. We are on Law FM, and let me use this opportunity to tell Nigerians, to tell Lagosians, that as long as you're on treatment, you can no longer spread the disease. You have the right to work and not be sent away from work.
Even though you might still be coughing at the time.
You can be on treatment as long as you are adhering. You should not lose your job. But there are people in these harsh situations, that people are going through. They have to lose their job because somebody has gone to disclose that they have TB. The employer is like, sorry, you can't come to work. And people lose their job. Poverty is on an increase. People are dying. Children are losing their parents and all whatnot. So it is important that people know that a person who is already on treatment can no longer spread the disease. Secondly, what I would like to say is that there is a medication that is called TB preventive treatment. If you have a family member who is having tuberculosis and is being treated for TB, the protocol is that the family members, the close contacts around that person, should access TB preventive treatment, especially for children. And once they have taken that TB preventive treatment, they cannot get TB from whoever is being treated around them. So it's important. And right now, to end this TB, there is only one vaccine currently that prevents TB in children. It's BCG, right? It's important that parents ensure that their children are vaccinated at birth. But the advocacy that we're also putting out there is that globally there is also a target to have a TB vaccine that can be able to, prevent TB in adults. So my advocacy point is also to the federal government, to stakeholders, to the private sector. Part of the reasons why we are not ending this disease is because the awareness is not there, and that's why we are here. We are pleading with private sector, we are pleading with the government to fund the TB response in Nigeria. Currently, the funds that is available to fund the TB response, 24% is coming from donors. We only have 6% that is funded nationally, leaving a gap of 70%. People are dying, and we need resources to be mobilized from all quarters. Our national budgets, our national assembly, our state assembly, private sector commit to corporate social responsibility to be able to support the goal to end this disease. It is important and it is crucial.
Yeah, thank you so much for stopping by to have this conversation and continue to push this advocacy. I've been speaking with Deborah. Okay, she's the executive director, Debridge Health Development Center, and of course, tuberculosis survivor Oguntokun Taiwo. We've got to go. We're really pressed for time. Yes, in 10 seconds finally. Yes.
Yeah. And just to say that the One Impact Nigeria is free of charge on App Store, on Play Store. Find it, download it to get more information on TB. Coughing for 2 weeks or more, check our mode. There's a toll-free number, 3340, for more information on TB. 3340, you get information. Thank you.
All right, appreciate that. Okay, we've got to go. Thank you so much again, Taiwo, and we wish you the very best as well. You get your job back, and life continues for you. Lagos, that's the show today. Please stand by for Women's Web. Daniela Jai is right here.
Thank you so much for having us.
Yes.
We are grateful.
Appreciate that. All right, Daniela Jai is right here for Women's Web this morning. Kingsley Bass is my name. I'll catch you again 9 o'clock tomorrow for the Love Morning Show. In the meantime, be good. Bye for now.
The finest brew of the law, like you have never tasted. Only on Law FM 103.9.